All right, good morning, everyone. Today we are reporting 86 new cases of COVID-19 in the state. This does include 5 new hospitalizations and 0 new deaths. We've had a total of 74 newly recovered individuals to the point where they're no longer able to transmit COVID-19. And in the 24 hours previous, 962 new tests had been reported. This does bring our total COVID-19 case count in the state to 10,360. Of those, we have 1,194 individuals who are considered actively infected. We have had 9,013 individuals who are considered recovered. We have 60 current hospitalizations, and we have a total number of individuals who have died due to COVID as 153. We have, since the beginning of the COVID-19 pandemic, had reported a total of 165,065 total tests reported to the South Dakota Department of Health. Of those, 129,293 unique persons had been tested. The information that I want to provide as far as community impact is that we are making a change today on our COVID-19 dashboard data. There are a couple of updates. The first is that we're splitting the 0 to 19 year age category into 0 to 9 and 10 to 19 years. So look for that update on the website. The second is that we have updated our definitions to the levels of community spread. And so we had previously been reporting based on the number of community-acquired cases, and we have transitioned that to align with both CDC's framework for community mitigation as well as some of the CDC's data around monitoring cases within states and within counties. And so to closely align with that, the Department of Health will be reporting none, minimal, moderate, and then substantial community spread. The definitions of those are listed on the dashboard website, but I'll go ahead and provide those here to you. So none is that we've had 0 cases within a specific county in the past 7 days. Those counties with minimal cases either have a rate of less than 10 cases per 100,000 population, or if their county's population is less than 35,000, they have between 1 and 3 total cases. For moderate, we're looking at between 10 and 100 cases per 100,000 population, or again, for those counties with less than 35,000 people, we're looking at between 4 and 9 total cases within the past 7 days within that county. Finally, for substantial community spread, we're looking at a rate of greater than 100 cases per 100,000, or for those counties less than 35,000 population, 10 or more cases within that county within the previous 7 days. We will be updating that level of community spread weekly, and so that information will be updated every Monday, and look for that on this call. And then I would also like to provide the cluster updates for today. We have one, which is that the Bethel Lutheran Home, we have 40 individuals who have recovered out of 43 COVID-19 cases among residents and staff. And with that, we can go ahead and open it up for questions.
Thank you, Dr. Clayton. We are now on mute in the lines, and you'll be able to take your first question. First question, please.
This is Kelly Hurst.
Go ahead, Kelly, please.
I've got actually a couple of questions. The Bonham School District just called off school for this week. They delayed their start for a week because of an outbreak, and also the courthouse is closed down. And there's been reports that this is tied perhaps to a golf tournament that occurred there. And then number 2, Yankton has seen its cases rise by 50%. I was wondering, we've been told from some sources that this could be due to a method. I was wondering if you could comment on either one of those.
Kelly, what was you kind of cut out on the Yankton situation?
Yankton has had, Yankton County has seen its cases increase 50% this month, and we've been told from some people that this could be due to a meatpacking plant outbreak or something. I don't know if there's anything, you have any information on that?
So, yeah, the information in terms of increasing cases within Yankton County, you know, we've not been able to attribute that to any specific exposure setting, work setting, and so on. And so we'll take a little bit closer look at those cases. The Bonham County cases, you know, we continue to see cases all throughout the state, and so you know, I don't have any specifics related to the cases in that county, but you know, as we have in the past, over the weekend, you know, if we have locations where we identify individuals who have pose a potential exposure risk to individuals within the public, you know, we do issue those as public notices. And so there's been nothing to my attention that has arisen to that level in either Bonham or Yankton counties.
Next question, please.
This is Lisa.
Yes, go ahead.
Go ahead, Lisa.
You know, it's been about 5 months now, and we just hit 10,000 cases. Just wondering how many cases do you believe there have been who have been asymptomatic and not tested?
So according to some of the literature out there, I mean, the percentage of individuals who have totally asymptomatic infection is 16% or higher, according to the CDC's website. And so, you know, we know that in certain populations, that percentage can be greater. And the primary focus that we do have is around testing individuals who do have symptoms. We know that in certain circumstances, you know, including household settings, that poses one of the greatest risks for transmission of COVID-19. And even if individuals remain asymptomatic, the recommendation that we have discussed moving forward with, and which has currently been updated on our COVID-19 update as of Wednesday at 11 o'clock, that webinar, is for individuals within the household, whether they're symptomatic or asymptomatic, to seek medical evaluation and potential testing, and that will help identify some of those populations or those groups at highest risk of COVID transmission.
Next question, please.
Jack Cottle with KEBN and KOTA.
Go ahead, Jack.
We had received a message from someone concerned about what they thought was a substantial number of cases at Black Hills State University, and wanted to see if you could comment on that. And at what point, at what level does a number of cases in a university setting become a concern and an issue?
Well, what I would say is that even a single case on a college campus or in a school is you know, a focus of the Department of Health for a prompt response, working very closely with those points of contact at those specific locations to decrease any potential ongoing risk of transmission. You know, what I can say, you know, specifically is that, you know, we are looking at the timing in which we notify about school and college cases, and that, you know, specifically with Black Hills State University, that we do know of, you know, currently 3 cases on that campus, but it's, there again, that's not reaching kind of that typical threshold for notification, but we are looking at making that information more transparent as we go into the fall, where we have college students and students coming back to school and college.
Next question, please.
Yeah, Ben Chase with the Plainsman in Huron.
Go ahead.
I'm just curious, kind of a two-part question. First is the notice that Beadle County had 4 total tests listed today, and 5 new negatives. Just curious if that's just a matter of reassignment of a negative test, or if there's something there in the numbers that we're not seeing. The other one is just if Kim could give any updates on the state fair and testing procedures going on.
Ben, I'll answer the second question first. We are actually talking with folks in Beetle County here later this afternoon, and so hopeful to have some more information for you yet this week on what testing will look like after the state fair.
Yeah,
thank you.
Sorry, and I was going to say, and as of the number of new negative tests, that those are reassigned kind of more routinely. That's not something that we do provide updates on, but what I would say is that as we identify additional information, even on much older tests that have been negative, that we do assign those to the appropriate county. And as you can see, I mean, we have a large number of counties on our website where we have unassigned, and so a lot of those, as we find out and get more information on those, we are updating those tests to go into the appropriate county.
Okay, thank you.
Mm-hmm. Next question, please.
This is Morgan at the Rapid City Journal.
Go ahead, Morgan.
How important are ventilation, filtration, HVAC systems, or air quality in preventing or killing coronavirus? Say, for instance, in a school, is there something schools could do about the air quality to prevent the spread?
So that's a very good question, and one that does come down to the administrative controls that can be used to decrease risk of COVID-19 within schools or any sort of business where you're able to increase the flow of air exchanges through the building, as well as increasing the percentage of air pulled from outside. Which again has the effect of decreasing any potential COVID-19 droplets that might be within a specific classroom when talking about school settings, and just increasing the flow of that air to disperse those particles. The same is a little bit different overall focus, but the same is kind of true with negative pressure isolation rooms in hospital settings where the number of air exchanges, in this case you're pulling that air into that room and so on, but the number of air exchanges it happens each hour is much higher than in a normal building and so on. So there are administrative controls that schools and other businesses can put into place that do help decrease the risk of COVID-19 transmission.
If I could ask a second question, are we seeing any cases arising from surges yet in in-state residents or out-of-state residents that visited the rally?
So we have had the one case of an ill worker at the Bump and Buffalo Bar and Grill that we issued a public notice on Friday. So that is the one case where we have had public notice surrounding it. At this point, we don't have other cases that have either risen to the level of needing public notice or that we've specifically identified, with only sort of rally exposure. And so that's something that, we continue to monitor and are very cautious, as we're making sure that we're following up on cases so we can appropriately identify exposures.
Thank you.
Next question, please.
KP from KORN News Radio.
Go ahead.
Thank you very much. Could you give us an update on how the mass testing of EMS and other workers is going?
Sure, JP. This is Kim Elson-Reisden. So relative to congregate, folks that are living in congregate settings, the mass testing there, we're just shy of 1,000 people total That includes staff and residents, and we've got another 8 providers that are scheduling mass testing, so we will see those numbers increase. Of the 955 actual folks that have been tested in that group, we've seen 22 positive, so a positivity rate of 2.3%. The other thing I would note is that the folks, those providers that have done the mass testing from the congregate care side will be moving into sentinel testing, which is selecting a small number of random people who are asymptomatic to test to hopefully determine if there's COVID, in those facilities, and we can take appropriate precautions. Relative to EMS, we'll have more of an update here. We're going to wait a couple of weeks and then beginning that mass testing again after the rally, starting in West River, South Dakota. That testing will be an option for EMS, law enforcement, and firefighters. Again, it is voluntary, but we are hoping to have good participation in that. We'll start in West River, and then we will move kind of through the state and finish East River. So that will be an option for all of those EMS, firefighters, and police officers in the state.
Thank you.
Next question, please.
Lee Strubinger, SDPB.
Go ahead.
I was just wondering if either of y'all had any concerns about sort of what appears to be a steady increase in COVID-19 cases since the middle of July, and maybe what you make of that.
So, what I would say is that, yes, the increasing number of cases that we have seen in the past few weeks is an area of concern. It's something that we are monitoring and, looking at, where the cases are occurring, looking at which population groups and trying to identify how best to intervene to avoid ongoing transmission. The unfortunate side is that, I think a lot of the response, from Department of Health and from individuals, relies on taking appropriate precautions, awareness of those precautions, and so on. And so the important thing to keep in mind is that, individuals do need to take personal action when they're out, and I think a little bit of what we're seeing is COVID-19 is kind of becoming a little bit more of a standard within the community, and that is concerning because of the level of severity of illness, and we want to make sure that individuals are taking precautions. The other thing that this does have impact on is that when the Department of Health is calling individuals, it does help us for folks to pick up on that first call as opposed to calling several times and trying to get a hold of individuals, and that's true whether you're a case or a close contact. We want to make sure that folks are picking up the phone and that we're able to get a hold of them to speed up how quickly the case investigations are being completed and people are being notified of their potential exposures.
I would just add, Lee, that, in addition to the case numbers, obviously, we actively work with our healthcare partners around hospitalizations and need and use of ventilators in ICU, and so far that has been, very well managed, and we have not seen a strain on our healthcare systems relative to hospitalizations related to COVID. So, in a rare bit of, good news, I think that's something to point out. And, certainly our work with the long-term care industry and other, providers of services to vulnerable people has been a focus and will continue to be a focus. And so we've seen a relatively low number of cases in those settings, and that's really important because, of course, they tend to serve people that are vulnerable to poorer outcomes.
We have time for one more question. Can we please have the last question? Seeing none, we thank you for joining us today, and have a great day.